Dr. Syed Haider of My Go-To Doc and the My Go-To Stack vitamin company. So mygotodoc.com, where you can get healthcare for many different issues, including COVID, vaccine injury, long COVID. You can get prevention, treatment, you can get travel med kits, you can get emergency med kits, antibiotic med kits, stuff like that, as well as lifestyle coaching. And then my go-to stack is where we do, where I've developed my own line of supplements. I would say that they're the best in the world, and I think that they really are. Some of the most popular ones are the immunity vitamins, and then the detox one, the Spike Buster. We should probably actually name the immunity herbals detox herbals, because that really goes hand in hand with the detox Spike Buster. You should take both of them together if you want to do detox for spike protein. Anyway, I know I've been gone for a little while. I haven't been doing these live streams because I've been traveling. I went to visit San Francisco, went to see some of the redwood trees, and drove around a little bit. And it wasn't as bad as I was expecting, actually. I'd heard horror stories about California. At least San Francisco is not that bad. I drove all over the place, and it was in pretty good shape. So that's good news. So hopefully we can bring California back from the dead. And maybe parts of it aren't as dead as we thought. Anyway, let's see. We have a bunch of cute questions. I'm going to start with the ones that we've collected over the last couple of weeks, and then if anyone in the live stream chat has a question, I'll try to get to those too. So I'll try to keep an eye on the live stream chat here. All right. The other thing that we've been doing, the new thing at My Go-To Doc, is the Hakim service. Hakim Shabazz Ahmed. Hakim means wise man. And he is available at mygotodoc.com/Hakim, Hakim. That's been quite popular with a lot of patients signing up to talk to him. It's a really in-depth, deep dive, highly personalized, fully all natural protocol developed for each patient. So it does take 1 to 2 hours to do the intake. And he has to do a lot of research on each specific patient that he sees. So it's quite a investment of time and resources on his side and also on the patient's side. So for their own part, have to be ready to invest quite a bit into changing, their habits, lifestyle, and doing things a lot differently. So if you are in that place where you want to really get to the deepest root causes and basically the spike protein, other issues that come along and make you sick, the stage has already been set for them to affect you. And it's not only them. It's kind of like I've been saying for some time, that it's like the last straw, right? Or the last few straws. But there were a lot of other straws there before. So if you want to remove all the straws, you want to reset your health, get back to feeling better than you probably ever have before, actually, then I think the best way to do that is with a really comprehensive, personalized program that's natural and that doesn't rely on Band-Aid approaches. So that is available there. Let's see. Okay, so without further ado, let's pull up some of the questions. I guess one other thing before, so a little bit of further ado. We are working hard to release the Malungo bark, which is, I think, the single best thing I've come across for anxiety and insomnia when it's really pathologically bad. So, if you have kind of normal, mild, even maybe moderate insomnia, most of the time, most people with insomnia, almost everyone with insomnia, unless it's really pathologically really bad, they can fix it with pretty simple approaches. So lifestyle changes, right? So what we call sleep hygiene, sleeping at the same time every night, turning off the lights at night, or at least wearing darkened blue blockers, sunglasses, not eating late, not stopping caffeine, getting up and seeing the sun before 10 a.m. every day, like clockwork for at least 30 minutes. These kind of things. Maybe doing some meditative work throughout the day to calm down, not doing work, in the last, after sunset, not getting upset after sunset, a bunch of these things will usually help, and the light environment will probably help the most for most people. But, with long COVID and vaccine injury, sometimes your nervous system is just like fried. I mean, it's just like, actually, it's like, you're wired but tired. That's I had it myself, and it's insane. It's just crazy. It feels like thoughts are racing, and yet you are exhausted, right? And yet you just can't sleep. So for people who really need help, and it's like some of these people, in the past, people have just prescribed something for them, a drug to make them fall asleep, to just kind of like knock them out. That stuff is not great because it doesn't give you a healthy, natural sleep. And I think Mulungu bark is actually stronger than most prescription sleep aids. And so if you're in that situation, if you're in that boat and you need this kind of bridge to normalcy, you need something to bridge you until you can get off of these supplemental aids, then Mulungu bark is where to go. And it's best to drink herbs, I think. Even our herbal product, you could take the pills and you can dump it into like some tea or some warm water and drink it. That's really the best way to take herbal products, rather than keeping them in the capsule, popping the capsule and swallowing it without tasting it, because your body starts to respond to the effects as soon as you taste it on your tongue, and some of it gets absorbed and goes straight into your brain, up into the brain, from the mouth. Without bypassing first pass metabolism in the liver. So when you swallow it and it goes through your digestive system, first it goes to the liver, some of it gets metabolized, then it enters your bloodstream. But if you absorb it through the mouth, you bypass that first step, where you're metabolizing part of the active ingredients, and you just get the effect going straight into your bloodstream, dumping straight into your immune system. So yeah, drinking it, I think, is the best way to take herbal products, and actually tasting it. And Mulungu bark doesn't taste too bad. You can, and it does have a bit of an herbal taste, but you can mask it with an herbal tea or a juice or a milk or whatever. I would suggest just having it with water so that you actually do taste it. So again, your nervous system responds to the actual taste of the thing. So if you're masking the taste, you're not going to get that effect, but you still will have some of the other benefits of, likely absorbing some of it very early from the oral mucosa instead of letting it go into the digestive system. So the benefit, you can find Mulungu bark right now online. I tried pure, just Mulungu bark powder that was not an extract, not purified, not strengthened, and so it has a lot of inactive ingredients, fiber and cellulose and stuff in it, as you would expect from a powdered bark. And it works great, but you just need to use a little bit, more than if it was purified and you got rid of some of that inactive stuff, the cellulose in the bark, in the bark, the fiber, right? So what we did was we wanted to try to strengthen it and focus in on the active ingredients, so get rid of some of the fiber, right, that's taking up space, bulking it up. And so we did a 20-to-1 extract, which is stronger than anything else I could find online. We tested it against plain Mulungu bark that wasn't extracted. We tested it with 5-to-1, 10-to-1, and this 20-to-1. And it was very, very effective, right? So I've a number of people have tried it now in my circle, and I asked on Twitter, like, people, do you want to try it? And one lady really just gave rave reviews. Let's see if I can pull that up, and I'll quote her. But a number of people got back and had similar experiences. So on Twitter, this is Pixie Trader. Her name is Linda, from New Jersey. So she said, I wanted to let you know I love, capital Love, I love this extract. It helps my anxiety, blood pressure, and promotes a very restful sleep. I gave some to a friend who has a very hard time sleeping for years. Who she used to be on Ambien, weaned off of that, then was taking THC gummies, which were not helping. She has thanked me and you profusely. She sleeps like she hasn't in years. I took it with warm hibiscus tea, 2 scoops, which was at the time, I mean, in the kind of the pre-release version that we sent her, we had these tiny scoops that were 1 milliliter each. So she took 2 mLs of the powder in hibiscus tea for mild anxiety, and 4 mLs, approximately 4 scant scoops before bed, gives me the most restful sleep ever. And I wake up so refreshed. I just love how gentle and effective it is. Thank you so much. So it is gentle if you use the right dose, right? Like it just puts you to sleep, and very quickly, within 10, 15 minutes, you feel like going to sleep, you feel tired and you fall asleep. And similarly with the anxiety, if you overdo it, it's not gentle. It will give you some side effects, right? And it will really probably knock you out. So you want to be careful with it. You don't want to use a big dose right away. Just because she said she used it for some mild anxiety at 2 scoops, for some people, 2 mLs might knock them out, or it might give them side effects from severe anxiety, and maybe they just need 1 mL for their severe anxiety. So one of the reasons I think some people might not promote this. I mean, most people have never even heard of it. Most people don't know about it, but there are people who do know about some of these super strong herbs, and they hesitate to tell people about them, or to market them, or to use them, or even certainly sell them, because they are really strong. You need to respect them. And one of the things that people don't realize or appreciate is that if you use the right strength and the right herb, it can be far stronger than a medication, right? Than a pharmaceutical. And most people don't believe that. Most people think it's the opposite. Most people think pharmaceuticals are far stronger than herbal products. It's not true. First of all, most pharmaceuticals are some sort of purified herbal product, right? But they come from herbs, or they tweak the structure a little bit so that they can patent it. But regardless, you can get very, very strong effects, and people who specialize in Lyme disease, for instance, oftentimes prefer herbal combos nowadays over pharmaceutical drugs, just because they're very effective, and they're more effective, not just very effective, but more effective. So that should be out hopefully soon. We're still these things take some time. We have it ready to go. We just need to finish the label and put it up on the website and finalize the bottle, and the scoop and stuff like that. So hopefully that'll be out soon. The other thing, so getting back to insomnia, this works great if you've got some pathological insomnia. Even if you have a little bit of mild insomnia, you just want a little help. I don't like people to get stuck using solutions like this long term. This is meant to be a tool to help you get to the point where you can fix up your life so that you deal with the underlying root causes of the insomnia. So it's meant to be a bridge while you are dealing with underlying root causes, like detoxing from spike protein, or maybe giving your body a chance to get through it and detox on its own, or dealing with other things that you may be dealing with, other issues, inflammation, right? So insomnia is due to nervous system overload, basically, and inflammation, right? Just like all chronic health issues are due to inflammation. And a lot of times it's because you can't get either, you could call it energy or fluid or toxins out of your brain. So another thing that can help tremendously is brain detox. So Hakeem Shabazz, my good friend, he shared with me an incredible brain detox recipe. You have to make it yourself. It's easy though. You buy the ingredients. So it's made from turmeric, chondroitin sulfate, hemp seed oil, olive oil, castor oil, DMSO, ginkgo biloba, and sunflower lecithin. All the ingredients are very important. When you put these together in a blender, the sunflower lecithin will create liposomes for the other ingredients that will become, they will enter the liposomes, and you mix it up in the blender for maybe a minute until it starts to get warm. And then you let it rest for 30 minutes, blend it again for a minute or so until it starts to warm up. Doesn't get hot, but just warms up a bit. Let it rest again for 30 minutes and then blend it one more time, and then you're done. So I will share the recipe. There's one final ingredient that he doesn't like to include in the recipe because he's worried that the active enzymes in it might, start to break down some of the other ingredients. And that is either a raw wild honey, or better yet, a bee propolis. So, a propolis extract from raw honey. And he likes the pollen nectar brand of propolis. So that's also included in this link. It's a Google document that you can use. So anyway, he recommends keeping the bee propolis separate, or the raw wild honey. So what you do is you apply a small thin layer of the bee propolis or the raw wild honey all around your neck, so front and back, and then you apply a thin layer of this cream that you've created, this liposomal cream, over that, and then you massage it all in, deeply for a minute or so. Give yourself a nice good massage, front and back, everywhere, and then you cover all of that with a castor oil pack. So like what I use is like a thin strip of t-shirt cloth soaked in castor oil. Wrap that around your neck, and it doesn't feel as bad as you would think. Like I thought it would feel really hot. It doesn't actually feel hot, I guess, because of the oils. It feels a little bit cool, actually. But it might take a little bit of getting used to having this like halter around your neck while you're sleeping. So you're supposed to do it at night before you go to bed. Sleep with it on, and then take it off and wash it off in the morning. It's going to be a little bit messy because of the turmeric in it. It's going to stain things. Right now, my collar has a turmeric stain on it, even though I took a shower in the morning after waking up. It's kind of hard to scrub off the turmeric and the oil, but it's worth it. It's incredibly effective for brain detox. What it does is it opens up all the detox pathways from the head and neck area and flushes the toxins down so that your body can get rid of them. But it just helps your brain get rid of everything that's up there that needs to come out. So you put the castor oil pack on, and then you can loosely kind of like put a loose towel around that so it doesn't mess up everything else, and maybe sleep on another big towel on top of that, and just try to protect the bed and everything else, bed sheets, from this, this cream. And in his experience, I mean, it can help reverse dementia, it can help reverse insomnia, certainly, right? So one of the big things with insomnia, one of the things that works great for insomnia, as well as tinnitus, right? So this brain detox cream should work tremendously well for tinnitus. And so one of the things that works for insomnia and tinnitus is these practitioners who can kind of adjust, the pathways and open them up through adjustments, through physical adjustments. So craniofacial work, craniosacral therapy, or maybe chiropractic sometimes can help. If you go to a really skilled person, it can help. And one of the ways that it may help is by helping to open up the detox pathways. But there's probably more to it than that. I'm not an expert in craniosacral therapy, but this can be super beneficial without having to go to a craniosacral therapist. And one of the things that we've seen with it is that people who have eye problems, or like a prescription eye, glasses, their prescriptions actually start to go down in many cases. So they'll find that they need less of a prescription as their brain, which includes the optic nerve, starts to detox. So anyway, I think that's about all I need to say about it. So I'm gonna post that in the chat, and Anas here can maybe post it everywhere else, but I'll put it into the Restream chat. It doesn't post to all the channels, but I think it went to Facebook and maybe Instagram. So we'll have to post it. I've already posted it on Twitter, but we'll post it into the comments of the live stream on Twitter as well. Yeah, that's not a great link, is it? We need to shorten that link, make it look a little bit prettier, and have a rerouted link. So yeah, sorry, I know that's not clickable when you see it, but anyway, that's the link for now. All right, so the first question Lily Vo has is, I'm taking so many vitamins and herbs, is it too many? So she doesn't list them, at least here in front of, from what I can see, so I don't know. Doxycycline for inflammation and respiratory infection, how long should you take it and how much? So, it really depends on exactly what you're using it for. If I remember correctly, it would be like 100 milligrams twice a day, doxycycline. And again, it depends on the indication, how long you would take it. If it's just kind of like a atypical pneumonia or even a typical pneumonia, maybe, 7 to 10 days. But there are some indications where you might need to take an antibiotic. If you're using it for Lyme disease, for example, it might be months, it might even be longer. Some people take it for other indications. So, yeah, we really need to know what exactly you're treating with it. The other thing, for example, anthrax, you can take it for a couple of months when you're using it to treat anthrax. Of course, you're probably not, but I'm just saying, like, if you have it as part, we prescribe it as part of kind of a disaster pack, emergency med kit situation. And the reason we prescribe so much of it, if people want that much, is in case of something like an anthrax attack. So yeah, hopefully that helps. Most common, infections, you would be talking about a week or two treatment course with doxycycline. Let me get back to the question. So as far as vitamins and herbs, I think people can certainly overdo it. And I think people oftentimes do overdo it or underdo it or don't do it for long enough or do it for too long. You can go either way. You can go to either extreme. Ideally, you wouldn't need to use vitamins. You would just get them from food. You would eat your vitamins in your meals rather than taking vitamins. And things like vitamin D, you would understand that you don't have a vitamin D deficiency so much as you have a sunlight deficiency, and you need to get more sunlight so that your body makes its own vitamin D, while at the same time benefiting from everything else that you get from sunlight, getting all the anti-inflammatory benefits of the infrared and the UVA, along with getting the vitamin D from the UVB and having it create more melanin in your skin, which also benefits you. So you need to get things as naturally as possible, and then use supplements only to supplement, right? Things that you are having a lot of trouble getting. So perhaps something like magnesium, K2 maybe, and vitamin D for a short period of time as a bridge to getting it naturally, right? So yeah, those are important considerations. And then herbs, it's, the approach that me and a lot of my colleagues have most of the time for most people, because this is basically all they're willing to do, is kind of a one size fits all. Okay, like we know that generally speaking, there are some herbs that are very safe and can be used for almost everyone, and they have amazing effects for getting rid of microclots and detaching spike protein and flushing out spike protein, things like turmeric and Nigella sativa and dandelion, that have been used for thousands of years, and you don't need to worry so much about is it the perfect herb for this particular person, because they have a lot of broad spectrum use and they are very safe, and they've like you can use them pretty safely in almost anyone, right? Things like if you have a stomach issue, triphala, is one of these kind of herbs that can be used very safely, and just kind of throw it at any stomach problem and don't really worry too much about it. So that's one approach, where in like, okay, nattokinase serapeptase, take some vitamin D and zinc and quercetin and, call it a day. And in 90% of people will start to feel better within a few months, and then they don't have to take these things forever, right? So it's a easy, quick kind of fix, and it will deal with the underlying problems, and it will also, for a lot of people, just give their own body time to heal and start to feel better, right? Get over it on its own and give some support along the way. That's kind of a one-size-fits-all approach, right? And a one-size-fits-all approach like that, you shouldn't take it and use it for the rest of your life, right? You should use it as needed. You should use it short-term. And if things are not getting better, in say 6 months, maximum, 9, 12 months, you should go to somebody who can assess you, like Hakeem Shabazz, like my colleague Hakeem Shabazz at mygotodoc.com/Hakeem, who can do a deep assessment of your personal case and give you a deeply personalized protocol, and then take you through the stages of detox and healing and strengthening your body again, and figure out exactly what you need rather than a one-size-fits-all kind of protocol approach. So more of a personalized approach. All right, so Kevin Ryan says, what evidence can you provide that the microclot test is valid? Dr. Bruce Patterson says it's fraught with issues, is likely invalid that likely invalidate it as a clinical tool. So this is a better question for Jordan Vaughn, who owns MedHelp Labs. It's a huge clinic. They have a lot of locations in Alabama, and for his lab experts and team. But basically, I'm not an expert on clinical labs. And so I don't know what Patterson is talking about. So if he could elaborate, what issues he has with the clinical tool or with this test, then we could talk about it. It's not an automated test, right? So it is something, it's a grading scale that's perhaps liable, you could say, to human error. So you are looking at a bunch of, you're looking at a blood slide, right? And you're swiping it around, moving it around, looking at different sections of it. And you're essentially counting up the number of clots you see and, looking at how big they are, how many and how big they are, right? And then you are grading it on a scale from 1 to 4. And so, yeah, there could be some issues with operator, training and error, with the preparation. And there could be issues with standardization of how you prepare these slides, right? So that's, those are the, various sources of error. And then other, issues with the test could be how valid is it, right? Like, okay, if you have a lot of microclots, does that mean anything, right? What does it mean, if anything? If you have a 3 out of 4, what does that mean? If you have a 2 out of 4, what does that mean? So the test was designed by Risha Pretorius, and it isn't, super simple to do, even though you can explain, how it's done, the procedure pretty simply. Jordan Vaughn wanted to replicate exactly what she did so that he could get the best results. So she actually traveled to the US and he had her train his lab team. They had to buy a specific microscope and, they had to stain it with a particular stain, and they had to learn, the preparation procedure, and so that they could replicate how she was doing it and get the same results she was getting in her lab. So she's perhaps the world expert on microclots. That's what she studies. She has studied them for years, even before the COVID pandemic. So microclots are not only seen in long haulers, it's just that the quantity of them is a lot higher in long haulers, and the quality is also different. So the atypical amyloid fibrin microclots are seen in long haulers. Another issue with the test, in my understanding, is that you can't distinguish between regular microclots and atypical amyloid fibrin microclots with this test. What it's basically doing is seeing the number of microclots, and when you see a lot more, that's also something that we haven't seen. So the two things that didn't exist before the spike protein showed up was the atypical amyloid fibrin microclots and this many microclots, right? So we're presuming that when we see so many microclots, at a higher number, a greater burden of microclots, that they are those atypical amyloid fibrin microclots from the spike protein, because that's the only time that you see that many microclots, when they are atypical amyloid fibrin microclots. So that's another issue, possible issue there. So she studied thousands of people, her and Beate Jaeger over in Germany, and other folk, other physicians, other researchers, they did this test using this procedure on thousands of people who showed up to their clinic, and they studied, how to treat them. Can we treat them with plasmapheresis? Can we exchange their plasma with fresh plasma, essentially, and thereby removing the microclots in the blood? And if we do this procedure a few times, do they feel better? And does that correlate with lower microclot levels on this test? And it did. So there were two things that they saw. They saw that high, scores above 2 out of 4 correlated with symptoms. There was not a single person who had a clinical diagnosis of spike protein disease who did not have elevated microclots on this test. Okay, so that was number one. And number two, there was a clear correlation between lowering the number of microclots on this test and decreasing symptoms. I've seen that time and again in my own practice, and I have not seen that correlation with Dr. Patterson's test. Okay, so Dr. Patterson's test, he says that it correlates very well and can diagnose, be used to diagnose long COVID vaccine injury, and perhaps it can. And I agree that every patient, okay, so what I do agree with is that also every time I have had a clinical diagnosis of long COVID or spike injury, right, spike disease, Dr. Patterson's test is positive. All right, so same as the microclot test. That's basically the same as the microclot test. If you have spike disease, the microclot test and/or Patterson's test will show positive. Where they differ is that almost always when the microclots go down, the symptoms get better, right? It correlates with improvement. So high microclots correlate with more disease, lower microclots correlate with less symptomatology and less disease. Whereas with Patterson's test, that's not the case. As people get better, his test doesn't seem to always get better. Oftentimes, it'll seem to be worse, or it might be better briefly, and then it'll be worse again, and it just goes up and down. It fluctuates, and you're not sure how to interpret it, right? You're not sure how to use that clinically, because I don't really need either test to diagnose you when you have the symptoms, right? So if you have symptoms of spike injury, they are enough to make the diagnosis. I don't need to do a test to confirm it unless you really want to, right? But I don't need to. I can treat you based on your symptoms. I can make the diagnosis from the symptom picture. It's very clear, almost always, that somebody has spike injury just based on their symptoms, because the picture is pretty specific, or the clinical scenario, right? So, okay, you were exposed to spike, and shortly thereafter, you got these pretty specific, constellation of symptoms. And so tests for me are more useful in tracking than in diagnosing, right? I want to know, are we going in the right direction? And so you would hope that they would, track along with symptoms, and as the symptoms got better, the test would get better. And then probably the most helpful, that the test can be is when the person has no symptoms left and you want to know, is there something left to do? Is there something still abnormal? I guess you could say that Patterson's test might work there as well. Like if it's still showing abnormal, then there is still more work to be done. So it's really up to people. We can do either test. We can do both tests. But the other, I guess, wrinkle here that I would that comes to mind is that his test is based on inflammatory markers. So the immune system is creating a specific pattern of what we call inflammation, right? So the immune system is acting in a specific way in reaction to spike protein. And his treatments are primarily Maraviroc and statins in order to stop the immune system from doing what it wants to do. Versus the microclots are like basically a direct physical reaction to the presence of spike protein in your blood. The spike protein just triggers the clotting cascade, around it, as well as misfolding of proteins. So that is more of like a physical insult where your body, to me, it seems, is not so much actively choosing what to do. And it's more of a reflex, right? Whereas with the immune activation and changes, that may be more of part of your body's wisdom in responding to the spike protein specifically. And so forcing it not to do that may be the wrong approach. And I'm not sure here. It's just it's a guess. It's a theory, right? So in general, I prefer to accept the body's wisdom and how it responds to the things that are happening to it. But if a bullet tears through your shoulder, that's it's not the wisdom of your body, allowing all that damage to happen. So that's kind of how I see the microclots as a physical kind of like insult from spike protein, forcing some proteins to misfold into amyloid and forcing a clot to be produced around it. So removing those microclots, I think, is far safer than trying to force the immune system to stop reacting the way that it wants to the spike protein. So it's what your body in its infinite wisdom is trying to do is protect you as much as possible and help you stay as healthy as possible and alive as long as possible while it's trying to get rid of the spike protein. So I think as a therapeutic target of action, the microclots are a safer thing to target, to get rid of, to improve blood flow and help remove the spike protein that's trapped inside them. At the same time, they're just not something that I think is useful to you, versus the immune activation may be. And so, and also the way that you have to target that immune activation using things like statins for 6 to 9 months and Maraviroc. I don't really like statins that much. I think they have a lot of downside risks, and I don't really like Maraviroc either because it also appears to have significant downside risks. It's not the safest drug on the block. I know Patterson will say no one has serious side effects. I saw one person who got really bad side effects and his labs got way off with Maraviroc. But still, I mean, it's relatively rare, maybe 1 in 300 or something, like that had such a severe reaction to it. But the long-term side effects are what are more concerning. And some people do stay on it for like a year or more, or they keep coming back to it. And longer term, you see things like heart attacks and strokes in the HIV patients that had it. And initially we were saying that, well, maybe the side effects that happen in HIV patients don't really apply to long haul vax-injured patients. On the other hand, maybe they do, because people with long haul vax injury also have kind of a HIV type of immune picture, right? In many cases, not always, but in many cases. So one small, private clinic that I spoke to, 30% of the vax injured had low CD4, CD8 T cell counts, similar to an HIV patient, what you would see in an HIV patient, and 15% of the long haulers did. So yeah, obviously the side effect profile doesn't apply exactly to this new patient population the way it did to HIV patients, but it's concerning enough looking at the list of side effects compared to other safer drugs like ivermectin that I hesitate to recommend Maraviroc before trying a whole host of other things, right? So I would say that, it goes both ways, but both tests have some issues. And I personally find that the microclot test is more useful, and the approaches to treating microclots are, I think, safer than the approaches to treating his immune, the immune activation that he's trying to reverse, right? And it's just more helpful. The microclot test seems to be more helpful for tracking. That being said, it would be great if we had funds to study it in more detail, and we don't. So, his company is, he has some ability to publish, tests and quote unquote validate things and all that. That's, as far as I know, not being done yet with the microclot test. So anyway, they both have their uses, and I've used both of them. And they're both about the same price. So I think they're both somewhere around $450, $500 each test. He has two tests, though. One is the immune kind of pattern of activation test in cell kind panel, and the other one is the S1 subunit test. I don't know how useful that one is, but if somebody doesn't have any symptoms, that's a different story. In that case, you might want to go searching to see, is there any evidence that I have spike toxicity? And I still think the microclot test is the place to start, but you could do this, Patterson test as well. So next question, Joanne Gula says, well, before that, Tammy Gravis says we were all natural before the vaccine. So yeah, some people are worried that, the vaccine has made human beings GMO, genetically modified organisms. I think there's a possibility, and people keep, tweeting out Kevin McKernan's work and other people's work. There's some in vitro work, in the test tube work, showing that cancer cell lines, like there was a recent piece of work published on, I think, an ovarian cancer cell line, earlier, I think, on a liver cancer cell line, showing that the nuclear DNA can be changed or altered, or you can have parts of the vaccine inserted into the nuclear DNA. Even if it gets inserted, it doesn't mean that it's actually causing any harm or damage, or that it can ever be activated. It's like putting a drop into the ocean. Like, it's just lost in an ocean of genetic information, and there's no way to find it again. So there's no way to go and find it, turn it on, express it, right? So I think it's a theoretical and pretty unlikely real world risk, that people have become genetically modified. When you want to genetically modify something, you want to be able to access that genetic information to do something, right? So when a virus goes in, it's an entire package, right, of information that includes a way to find that information within the vast sea of genetic information in your nuclear DNA and activate it at a certain time and start to express it, start to transcribe it into proteins and create a new virus and all that. The vaccine packages, what's in the vaccine, what's in the shots, is not designed that way. It doesn't have any of the accompanying tools to find it and activate it, turn it on, at a later date once it integrates into the genome. So I'm not really so concerned about this genetic modification kind of angle to the shot at this point in time. I don't think that's something people need to be worried about. So anyway, the next question was, or it's not actually a question, it's a comment. Joanne says, I'd like to share what I know about these spike proteins and how to get them out of the body and get the body to heal by reactivating people's own stem cells. So just as an aside here, you can activate stem cells in a lot of ways: exercise, feeling happy, meditation. oxygen therapy, so getting an oxygen concentrator, breath work, there's a lot of things that activate stem cells. It's not actually that hard to activate, quote unquote, activate stem cells. These are quote unquote light therapy patented patches you wear that work with your own body, with your body's own light. So your body produces light, right? Physiological light. The scientist and doctor who developed them is a genius, and the healing is nothing short of miraculous. There's a protocol for this. Am I allowed to put a link in here to explain it? A short video that explains how they work. I've been in holistic health for 20 years, and doctors all over the world are using these. They are calling it the quote-unquote biggest medical breakthrough ever. The most wonderful part is that they do not contain any drugs or chemicals and are non-transdermal. They work with your body's own infrared light to turn on your own dormant stem cells and create new ones. And there's a patch to reduce inflammation and anxiety, and another specifically for heart health and one for organ health. The healing is fast and miraculous. Let's help these poor people who are suffering. It sounds like what light wave patches. My mother actually used these like 20, 30 years ago. And a lot of people do come up and tell me about them, like amongst my patients. I've heard about it a few times. It reminds me of the chlorine dioxide, actually. People kept telling me, like, what do you think about this? What do you think about this? And I would Google it, and I'd be like, oh, this looks ridiculous. It looks crazy. It looks like, and that was probably an indication that, I should have looked more into it, more deeply into it. And when I finally did, I heard about it from somebody that I trusted, and who had used it to treat people, and then I finally was able to find the real information on it that had been scrubbed from the internet really deeply, deeply removed. So there was a lot of misinformation about it. I've heard rave reviews from a lot of people. What I would like is if anyone has some more information on the theory behind how they work. That's what I would like to understand, because when I've looked them up in the past, I haven't been able to come across anything that could explain them in a way that made sense to me. And again, it might have been scrubbed, but with light wave patches, you can find the website, they're sold online, but maybe they can't, and I might be getting the name wrong. It might not be Lightwave patches. There might be other brands. Life Wave might be what it is, and maybe not Lightwave. Let me see. I might have gotten the name slightly wrong. Reflect your radiance from within. I mean, it sounds like what she's talking about here. Phototherapy, stuff like that. So I'll take a look again. But when I had first tried to look them up and figure them out, I couldn't really understand the science behind them, what they were actually doing, but I'll look at it again. Our non-transdermal patches fit simply into your daily lifestyle. How do our phototherapy patches work? Your body emits heat, including heat in the infrared spectrum. Our patches are designed to trap this infrared energy, which causes them to reflect it back to stimulate specific points on the skin. They can promote a general state of health. So they're probably using acupressure points, perhaps? I don't know. Yeah, acupressure points, it looks like. People have used just pressure itself. There are these bands you can get for nausea that seem to work really well, that apply pressure to a acupressure point on the wrist. Some sort of, I forget the name of them, but they basically apply pressure there, and they work great for seasickness and nausea. And some people have used magnets on acupressure points as well, which seems to work well. So with stuff like this, it's, you can become a brand partner. So I don't know if people are, out there trying to get affiliate fees from other people or not, but it's one of the reasons why people might be out promoting it. There's always going to be a placebo effect, which is great. Nothing against the placebo effect. If you can trigger it with life wave patches, go for it. And there might be a real effect. I mean, I do think that there is scientific data showing that the acupuncture meridians are real things. They are real, and they do exist, and they can change your energetic system. And I'm sure they actually works well for people. again, it's one of those kind of like protocol approaches where you're hopefully using points and meridians that aren't dangerous to use or mess around with. Um, and if you're not finding long-lasting benefit, so what'll happen with some people when you don't address the root cause. So obviously, the root cause issue is affecting your whole body, your whole being, right? Including your energetic system. So the acupuncture meridians are going to be thrown off a little bit, and that sounds bad, but they're actually adjusting around something that's affecting them, right? So what looks negative is actually your body's maneuvering around a problem that you're not getting rid of, you're not, or that's unavoidable. And so it may be doing something helpful for you, and there might be some side effects of that helpful maneuver, right, that your body is producing. And then you go and you readjust, you force the energetic systems back into what you think of as balance, but which then leaves you open to the harm from the underlying root causes of your problem. So people can end up harming themselves when they either do it on themselves or go to a practitioner that is not focusing on the root cause problem and is working at a more superficial level and fixing what they consider to be the quote unquote problem, which is like they'll be like, oh, well, your liver meridian is out of whack, I need to strengthen it, or your heart meridian is weak and, or it's too strong, I need to, weaken it, whatever, right? So this approach, and especially with something like this where there's not even a practitioner involved, is fraught with risk. So that's one thing you just need to understand, that if you want to really address things at a fundamental level, then you need to have somebody guide you along the way, somebody like Hakeem Shabazz. So, yeah. I'm just seeing that they have an eye cream as well. You should probably just make creams at home, because they always have all kinds of like alcohols and sterols, and there's all kinds of things in them that don't seem like they should be there. You shouldn't be putting it on your skin. You're going to absorb stuff from your skin, and I understand why they have to put some of these things in there oftentimes to make the cream look better, stay together, and not separate, and not break down, and not, so there's all of these reasons for all of those, things that they put into these facial cream products. And this might be one thing that prevents us from actually like manufacturing in bulk the detox cream that I spoke about earlier, because you just don't want to put all these chemicals in there. You want to keep it all natural. So for now, at least, people should make that at home. And if you're going to put anything on your skin, it should be as clean as what you put into your mouth, because your skin's going to absorb it. Anyway, I have heard good things about LifeWave patches, but so what will oftentimes happen is somebody will use one of these modalities, and they'll feel great, and they might even feel like everything is back to normal. And then in a few weeks or a few months, like, this stuff shifts back, like your body accommodates this new thing that you're doing, and it's the same basic approach as modern medicine, the same fundamentally flawed paradigm where, okay, there's a problem, you don't address the root cause, you try to cover it up with a Band-Aid approach where you're focusing on the symptom instead of seeing that there's a cause. It's like you're blind to what's causing the symptom. You're like, okay, I have this symptom, I'm tired or whatever. Now I don't want to feel tired. That's bad, okay? I want to feel energy, right? And that's what everyone does. And so they do something to themselves, whether it's a LifeWave patch or glutathione or methylene blue or ivermectin or whatever, to get rid of that symptom, right? And sometimes it happens to address the root cause, but usually it's just like a shot in the arm, right, to make you more energetic. And there's like 1,000 different ways of giving yourself that shot in the arm. One way is through the acupuncture meridians, and other ways are through, crutches for your mitochondria, like methylene blue, and a whole host of different ways, right? Certain herbs can give you that shot in the arm. But they're not addressing usually the root cause of like why you're feeling fatigued or why you have whatever symptom you have, right? They're just focusing on the symptom itself. And that's the indication to you that it's working, is that your symptom's going away. But what you really need is to address on the root, is to look and see, okay, what is the root cause? Because if the root cause is not gone, and you're just covering up its effects, it is still having those effects on you. You just don't see it anymore, right? So the pain signal has been muted, which is not what you want to do, okay? You want to remove the source of the pain so that your body can then heal, instead of numbing yourself so that the thing that's hurting you can continue to hurt you, right? That's what's happening. So I've tried to explain this to people a lot of different times, and it's a key point of understanding that must be there and cannot not be there for really deep, long-lasting healing to happen. All right, so Molly says, what level of nattokinase should we take? So 100 twice a day, or yeah, I think that's what it is, right? So let's go check out my go-to stack, right? That's we have a nattokinase product at my go-to stack, and 2,000 FU, which is 100 milligrams. So 100 milligrams, which is the same thing as 2,000 functional units. So 100 milligrams of nattokinase twice a day is the usual starting dose recommended. And I would just say, go to my go-to stack, check out Detox Spike Buster. It's got nattokinase, serrapeptase, bromelain, humic acid, fulvic acid, EGCG, and some black pepper extract to improve absorption. And no additives or fillers. So you can go up from there, you can double it, most people don't need to go beyond double that dose, 200 twice a day. So start 100 twice a day, and after a few weeks, maybe go up to 200 twice a day. And it's nice if you can track something, either your symptoms or, take a look at the microclots. Give it like a month or two, right? Between checking microclot tests, because what we'll see is after 2 or 3 months, their symptoms start to improve and their microclot test starts to go down, and it might take 6 to 9 months total to like get back to like normal levels. But I've seen people dropping after 2 to 3 months, the microclot levels. Chris says, what specifically can an oxygen concentrator do to help with inflammation, cell repair, etc.? Are there any risks or potential oxygen toxicity if the microclot test shows 3 out of 4? So the main point of an oxygen concentrator, breathing pure oxygen for a couple of hours a day, is to stimulate stem cells, right? Stimulate stem cell production in the bone marrow. So it's going to do the same thing that hyperbaric oxygen therapy is doing, just not at the same time as you're not going to raise the pressure at the same time. In a hyperbaric oxygen chamber, you're also using an oxygen concentrator along with raising the pressure. So you're doing 2 things at once. Here, you're just using the oxygen part. So the hyperbaric chamber will drive the oxygen even deeper into your tissues. Well, not okay. I said that wrong. It doesn't drive it deeper into your tissues. The oxygen goes the same depth into your tissues in either case. But the partial pressure of oxygen, the amount of oxygen in your tissues, will be higher with the raise in pressure. But I don't think it's necessary to use the hyperbaric oxygen concentrator. It's a lot cheaper and more convenient to just use an oxygen concentrator. You're going to get a lot more oxygen in your tissues than you would by just breathing regular air, and it's enough to trigger. So it's not necessarily anti-inflammatory. It may even be pro-inflammatory. So oxidation, right? Like it's the opposite of an antioxidant, right? So it's actually going to trigger oxidative stress when you get exposed to oxygen. So it's kind of like one of those stressors that helps your body to get rid of problems later. So you apply some stress, and then your body reacts to that and reverses the problem later. So your body triggers its own antioxidant systems because you've raised the amount of oxidation happening beyond what it's used to. So it's kind of the similar approach as like jumping into a cold plunge. Like you're over, like your nervous system is like wired up and dialed up, but then you like dial it up even more, like you overwhelm it, and so it like slams on the brakes. So we're doing something similar there with the oxygen. We're raising the oxygen level in tissues. It's having a pro-oxidant effect, and that can directly kill harmful things. That oxidative stress can kill deep-seated infections and get rid of things in that way. And it will trigger the production of stem cells. So there are risks of oxygen toxicity if you go beyond a couple of hours a day of pure oxygen. You can't breathe pure oxygen all day long every day. You will cause toxicity to your lungs, first of all. So you don't want to overdo it. So a couple of hours a day max with the oxygen concentrator or HBOT. But yeah, there's no toxicity related to the microclot test being 3 out of 4. So I think it's helpful in most cases. What are your thoughts on baobab powder? I don't have any thoughts on baobab powder. I know what the baobab tree is. I don't know if baobab powder can be beneficial. It seems to be rich in important vitamins and minerals. So I don't know. Sorry, I haven't looked it up. I feel like somebody asked me the same question a few weeks ago. It seems like it's the same question. All right, so if you have any information on its usefulness, then let us know. Paul says, can COVID elevate intraocular pressure? It can really do, seemingly anything. I know that sounds crazy, but it depends on what problems you're prone to having. It can speed those up, right? It will create a systemic stress on your body, and that can manifest as speeding up the manifestation of problems that were developing anyway or that you were prone to anyway. So in that sense, yes. In another sense, yeah, probably it could also do that by the creation of the microclots in the drainage pathways for the eyes. So possibly. I have had elevated pressure close to glaucoma since COVID. No family history. I don't smoke or drink. My original symptoms were directly, they were loss of smell and headaches. Since the eyes are close by, is it possible it's COVID related? Yeah, it's certainly possible. Yeah, you might want to, address the amyloid fibrin clotting issue that is not just happening in the vascular system. The amyloid fibrin, the misfolding protein things clogging up stuff is happening all over the body and all organs probably in people who have significant spike toxicity. So ideally you would talk to Hakeem Shabazz, get a deeply personalized protocol for you, and you probably can't go wrong with the brain detox cream. Again, like I said, we've seen tremendous benefits with eye health. So get that brain detox cream going, at least if you don't go and see a practitioner to get a personalized protocol. That would be one thing that you could start with, along with nattokinase, serpeptase, all of those things, the spike detox approach. And maybe do some eye exercises too, right? So there are these eye exercises you can find online. I've found them to be very beneficial for glaucoma patients as well as patients with other eye disorders. Again, it's like if you Google it, everyone will be like, oh, they don't work. For a long time, people said meditation doesn't work, for anxiety and depression. And then they, after many, many years, they finally figured out that it does work. So, there's just no money available to test these hypotheses, but they've been used for thousands of years. So these things do work. Don Feltrop says, if someone took the Pfizer shot, I guess. Is there a homeopathic remedy available to help the person? And if so, what's the potency? How long should they take it? Yeah, there's no generic, one size fits all homeopathic remedy that I'm aware of. And, you need to go to somebody who's well versed in homeopathy to get them. My understanding from homeopathy is that depends on your symptoms, right? But maybe there's a different version of homeopathy where they just can give you something for a Pfizer shot. I've never heard of it though. You need to go to somebody who's real expert in homeopathy as well, because again, if they're not going to if they're working at a superficial level, it can throw things off and give you more problems down the road. Joanna says, I've been suffering with chronic fatigue syndrome since November 2022, frequently getting sick with colds to the point I've had to quit my career as a nurse. I've tried everything that was recommended and whatever I read about on my own. I just got diagnosed with pulmonary hypertension secondary to mild pulmonary fibrosis related to COVID after seeing a cardiologist and pulmonologist in Romania. Now, at least I know why I get so tired all the time. Nobody knows how to help. I found a study online talking about transdermal vagus nerve stimulation that showed some improvement. Yeah, it does help some people. Does anyone here know where or who would do this non-invasive procedure? Yeah, so you can do this yourself at home with a TENS unit, TENS. So you can find out more about it from the website reliefbeginshere.com, and under services, I think, let me see where it is on that website. SGB, stellate ganglion block for long COVID. He used to have something about the TENS unit on his website. I don't think I see that anymore. He may have removed, or maybe it's just not linked anymore. There used to be a blog post directing people on how to use the TENS unit. Anyway, you can get a TENS unit for like, $35, $50. You can spend a lot more on them, but you don't really need to. Let me just try one more time to see if I can find it. Yeah, vagus stimulation. It's still up, but I think he's not linking it. So it's reliefbeginshere.com/vagus-stimulation. I'll put it into the chat here. So yeah, that describes how to use the vagus nerve stimulator at home. You can do it for 10 minutes a day. Try it for a month or two. It's helpful, but again, something like what you're experiencing, you probably need to use some enzyme therapies to address the pulmonary fibrosis. Perhaps nattokinase serrapeptase would be helpful there. Maybe, there's a lot of roads that lead to Rome, right? So like, there's not just one pathway to healing, but one thing that might help would be nebulized heparin, and there might be some other really helpful approaches in terms of what you can nebulize. Maybe NAC, it's a common, and it's not expensive, it's commonly available for nebulization. Maybe glutathione and some other things, but Hakim Shabazz could also help you here tremendously. I mean, you could get back to work and, resolve all of these problems and fix them at their root. But yeah, so it's not something that you can't fix. It's just you have to remove the roadblock, and then your body will fix itself. Every tissue can heal, including tissues that we didn't think could heal, like the heart and the brain, nerves. So certainly the lungs can heal too. You just have to remove what's harming you, and then give yourself time to heal and a reason to heal, right? So if you accept lower functioning without trying to get back to the previous level of functioning, then your body has no reason to reattain that earlier higher level of functioning. So you have to understand that you're going to have to do some make some effort. So like if you've had like a severed nerve or something, you've had a nerve problem and you've lost, the ability to move your hand or something. If you just accept it and stop trying to move your hand, your body's never going to, regrow the nerve to your hand and re-innervate your hand, and you're just never going to be able to do it again. So it doesn't just happen automatically, and it's not just a matter of getting rid of the harmful thing. It's also sending the signal that, hey, I want this function back, right? So you got to do both. You got to remove the harm, and in the case of like a nerve damage, the harm was a one-time thing. But there are other harms, like there's other inflammation going on in your body from all the other stuff that you're exposed to in the world that you could remove to speed up the nerve healing. But still, nerve healing happens really, really slowly, so you have to have some patience. And then you got to keep trying to move that hand every day, right? You got to keep telling your brain that, hey, I want this ability back, and you have to believe that it can come back. And so there's some mind-body work involved, and maybe some visualization, and so you can do it. I'm not saying it's easy, but it is certainly possible. So check out mygotodoc.com/Hakim, Hakim. That's the best way to do it. You can also just go and check out our kind of generic protocols at mygotodoc.com. Scroll to the bottom and check out the long COVID protocol. Patricia Sandler says, Dr. Haider has said in multiple videos that an oxygen concentrator is very helpful, but I reached out to order one and was told that your primary doctor has to write a letter stating you need one. Sorry. I guess that was a mistake. It has to be ordered from a medical equipment supplier. It seems there's no way to get one. Okay, so you can get one through my GoToDoc. I'll let them know that we are offering them. You couldn't get me one either, so I don't know why it keeps popping up as recommended. Am I missing something? Sorry about that. I guess I didn't, someone on my team didn't realize that if somebody comes in asking for an oxygen concentrator for, certain reasons, then you can get it, but it's probably not going to be covered by insurance unless there's a insurance approved indication for it. So yeah, I'll let my team know that that was a failing on my part. I think I didn't properly communicate with everyone on my team that you can now get that done through mygotodoc.com. So yeah, we'll do that. So if anyone wants to get an oxygen concentrator to do home stem cell therapy, you just need a prescription, right? We send the prescription to you and to the medical supply, perhaps if you have one in mind, but you can just take the prescription to the medical supply store that will be in probably every town in America, and they will dispense the oxygen concentrator to you. You can either, I would say, rent it for maybe a month or two, or just buy it. It probably costs $500 or so, maybe $30 to $50 a month to rent it. So yeah, that could be a great stem cell therapy on the cheap, cheap way to do stem cell therapy at home. Angelina Hughes Rourke says brain issues and white matter changes on MRI with brain fog, memory issues. Do the brain detox cream that I mentioned earlier, and the detox spike protein supplement, the spike buster supplement, if it's spike related, and lifestyle changes, right? Get out in the sun, sleep well, eat an anti-inflammatory diet. This stuff can be fixed. So Karen says, have you had anyone with mild obstruction on a PFT before COVID, but then after COVID it becomes moderate to severe COPD? Yeah, I've seen that. Non-smoker, noticeable shortness of breath with a flight of stairs. Yeah, it certainly does happen, and it can be reversed. So one of the things that was really helpful, going back to what I said earlier about the person with the pulmonary fibrosis, nebulized acetylcysteine, so NAC. You don't want to just take NAC powder from a capsule or from a bulk NAC and put it in a nebulizer machine because it's very acidic. So it has to be balanced with a base. So they sell it in pharmacies, or you could get it from a compounding pharmacy. But it's a common drug, actually. It's a prescription drug that's available for COPD patients, especially in hospitals. It's not used so much in the outpatient setting, probably because in rare cases it can actually, it basically kind of like melts the mucus, right? The thick mucus, it kind of liquefies it. So if there's a ton of thick mucus and it all gets liquefied, it can actually kind of worsen the problem a little bit. And they sometimes have to do suctioning in the hospital. So you want to be careful with it and try a very small amount. If you're doing it at home, you just want to be careful about it, not overdo it. And in rare cases, there could be a kind of paradoxical like bronchospasm that happens. So if you have a bronchodilator, that'll help reverse the bronchospasm that might be triggered by it. But overall, it can be a life changer. I mean, I've seen it. Somebody had a chronic cough for years, just went away basically overnight when they did this, started nebulizing the NAC, and it was like basically like cured. I mean, it was incredible. So using, you just have to be careful with things like that. It's very strong stuff. All right, so Daniel Morlang says, has anyone had success with autonomic nervous dysfunction? I'm still dealing with much higher heart rate and exercise fatigue 2.5 years following a difficult bout with COVID. Very frustrating. Yeah, I've had great success with autonomic nervous system dysfunction. The Mulungu bark could be helpful, cold plunging, the vagal nerve stimulator, just neural retraining can be a part of it as well. So I know it's tough, finding the thing that makes the big difference. So you got to keep trying new things. Keep trying things if you haven't gotten there yet. And ultimately, if you've gone through the list of all the different things that people have tried in the past and nothing's working, then get a personalized protocol, right? Go to Hakeem Shabazz and get something personalized to you. And I've never seen that fail when the person gives it a good shot, an honest try. Ryan Livingston says tests we can be using. I've heard there are some spike protein test labs we can draw. There's a whole lot of tests that can be done. They're not absolutely necessary, but you can do them in different situations. So like we said before, the microclot test, InCellDX, they have those two tests that I mentioned earlier. One is the InCellKine panel, checking kind of like a pattern of activation seen in spike protein diseases. The other one is a test showing the monocytes carrying around a little S1 subunit of spike protein inside of them, which makes them act, differently than they normally would. And then there's a immune subset panel. A simpler version of this you can get from LabCorp or Quest. It can show things that you might see, a picture of HIV, right? So you can see lower CD4, CD8 T cell counts, stuff like that. And there's a more advanced version of that test from Cyrex Labs. You can get a very cheap test, the spike antibody level test, to see how much your body's reacting to spike protein. And when the levels are very high, that means there's a lot more antibodies than you would expect. Normally, that could mean that either immune system is overreactive, right? Or there's just a huge amount of spike in your environment and inside your body that you're reacting to. So usually very high levels, especially above 500, but sometimes you'll see into the tens of thousands, seem to correlate with spike disease. And then things, just standard inflammatory markers, ESR, CRP, ferritin. And then there's a bunch of nutritional tests that can be done to help make sure that you're getting all the nutrition you need for your body to heal properly. So there's a lot of tests, and we can help you with that. We have a lab testing site. I think it's labs.mygotodoc.com. You can go over there and we can help you out with lab tests. if you click on all labs, there's a link for a refundable consult. So if you just want to do a consult before ordering the labs, the price of the consult will be applied towards your lab order later. So Cindy Hammer says, with the carnivore diet, is there any concern about increasing cholesterol? I recently had my total cholesterol drawn. I'm wondering if I need to go plant-based to get it down. Yeah. What are your thoughts on cholesterol? I feel better when I eat more meat, less inflamed. My histamine doesn't seem as high. Yeah. So I think cholesterol is more of a boogeyman. It's not like it's not real. It's not a real danger. So, okay, so it's not exactly a boogeyman. What it is it's like a cleanup crew. It's like your body is responding to some other some inflammation somewhere or some chronic infection. In order to deal with that problem, it's raising the cholesterol. The cholesterol itself is helpful for you, right? So it's not a bad thing. So I don't think that we should be focusing on cholesterol. And the people at the cutting edge, perhaps you could say, as close to the cutting edge as you can get in mainstream medicine, who, the lipidologists and stuff, I think what they're starting to understand is that the effect of statins has nothing to do with their lowering of cholesterol per se, and that may actually be a negative effect of them, that they're lowering the cholesterol. If they have beneficial effects, it's due to their anti-inflammatory effects on the vascular system. So they have some anti-inflammatory effects in the vasculature. And you don't really want to lower cholesterol. That's not something you want to do. So diet may have some effect, and usually it doesn't. So how much cholesterol you eat should not really be affecting your blood cholesterol levels. If you lower inflammation in general, your cholesterol will probably go down. If you feel better on a certain diet, that's probably better for you, right? So I think we need to start listening to how we feel, not worrying so much about our lab tests. And the cholesterol lab tests I just don't think they're specific enough, and I don't think they're helpful enough, at this point. So if you, again, go to somebody who can help you really address the deepest underlying, issues leading to inflammation and help you detox and help you get rid of stuff, then your cholesterol will likely go down because you won't need it anymore, or you won't need as much of it anymore. And meanwhile, if you don't address those deepest underlying issues, then the cholesterol is helping you. It's not harming you. It's helping you to deal with those things because they're not going away. So, yeah, so I don't think it's the right approach to go and search for herbs and supplements to lower your cholesterol, right? If they happen to be working on the underlying problems and secondarily lowering cholesterol, that's the right approach. But that's not the approach that people take. People are looking for things specifically that will force their cholesterol down, just like a drug does, right? That's the wrong approach. You should not be doing that. So yeah, cholesterol is not really linked to diet, and the carnivore diet should not really have an effect on your cholesterol levels. And even if it did, I wouldn't think that would be a harmful thing. So I don't think the carnivore, I was on this little carnivore kick for a while. I don't think that carnivore is appropriate for most people, but diet really depends. It's very individual, right? So the best way to figure out the optimal diet for yourself is to reach a state of optimal health, and then you'll notice when you eat something whether you feel better or worse, and that's the best way to figure out what's optimal for you, not by just going and trying a particular diet. You might actually feel worse on a particular diet and that might be a better diet for you. And the reason you're feeling worse is because it's helping you detox, right? And diets can be used for particular reasons at particular times. So you can go on a specific form of a particular diet in order to detox, and then later on you change it a bit, you change it around, you add some things that you had removed that are generally healthy, but wouldn't be promoting detox. So there's a detox phase, and then there's a building phase. So you have to understand where you're at. All right, everyone. I think we are done for the day, unless there's any questions here. Okay, so Tammy says, it almost killed me. I tried it all. TT is much better than rock. Okay, so she's talking about Rav Rock. Yeah, so most people are don't have significant issues with Rav Rock, but like I said before, some people do. And there is a solution for you, Tammy. We can help you find it. And if you're in that boat where you've tried it all, and you're still sick, then the next step is to go to somebody who can create a personalized protocol, who has the experience to get people better and has done it time and again. So that is, again, mygotodoc.com/Hakeem, my close friend and colleague, Hakeem Shabazz. All right, everyone, thank you for watching, and I'm not sure when we'll do it again, because I'm going to be traveling again to visit my parents again on Saturday, and I'll probably be flying until Monday. So hopefully next week, Wednesday, we'll schedule another live stream. All right, everyone, until then, stay well, and please like and subscribe so that we can spread the word here and help other people find this information. All right, bye-bye.